And the federal agency giving guidance on how to pay for the president's so-called big, beautiful bill passed late last month says Congress has to slash hundreds of millions of dollars from health care programs like Medicaid. So what does that mean for you? NewsNation's Tom Dempsey is on Capitol Hill to break down this story. Tom, how many people would these cuts impact, and what do they mean for quality of care?
Hey, good morning, Markie from Capitol Hill. Look, the Centers for Medicare and Medicaid estimate that 79 million Americans are enrolled in Medicaid. And with these talks over budget and government spending continuing and leading to concerns over possible cuts to Medicaid, AARP recently sent a letter to our sister publication, The Hill, warning about a possible, quote, serious care crisis happening in the country if those possible cuts end up happening. But this all comes as there's lots of talks over that one big, beautiful bill, as President Donald Trump calls it. And Republicans are looking to pay for the extension of President Trump's tax cuts by slashing $880 billion from health-related programs. But according to this week's report by the Congressional Budget Office, which is nonpartisan, even if lawmakers on the Energy and Commerce Committee dump all other programs that fall under the jurisdiction other than Medicare and Medicaid, that would only save $135 billion tops. That could bring, obviously, very big impacts across the country. And while Washington, D.C. has the highest percentage of its population enrolled in Medicaid or the Children's Health Insurance Program, Louisiana, Alaska, Kentucky, Oklahoma, and Arkansas all have similarly high enrollment rates. President Trump has said those programs should be off limits, and Republican lawmakers say Medicaid is not mentioned once in the big, beautiful bill. Instead, House Speaker Mike Johnson says savings will come from identifying waste, fraud, and abuse within the system.
Medicaid has never been on the chopping block. What we're talking about is finding the it's non-benefit related reforms to the program, right? Medicaid is infamous for fraud, waste, and abuse.
Now, on the other side of this, some Democrats, like Texas Congresswoman Jasmine Crockett, accuse Republicans of intentionally misleading Americans.
You're scared because you lied. Donald Trump said he didn't know anything about Project 2025, but we know that literally he started on page 1. He didn't want to say that he was going to get rid of the Department of Education. He didn't want to say he was going after Medicaid, Medicare, and Social Security. But those are the things that he is doing. He did not campaign on those things.
So to be very clear, details are still sort of coming together, specifics about this one big, beautiful bill spending package. But obviously, many people are going to be watching when more information comes out about what could possibly be cut, Markie.
We're following this closely because I think a whole lot of American families are saying, whoa, 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 how is this about to impact me? Tom Dempsey live on Capitol Hill. Thanks so much.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.